Hi guys, my name's Dan, I'm a veterinarian, and today we're going to go over bladder stones in the doggy. I'm going to go over 3 steps: what the pet owner sees at home, how I diagnose it, and how we treat it. As always, if your puppy dog is sick, please go see your local veterinarian. These videos are for educational and entertainment purposes only. What will the pet owner see at home? Blood in the urine, frequent urination, straining or struggling to urinate, and maybe an irregular urine stream can all be signs of a bladder stone. When the owner comes in, we go over everything we just talked about. Their history, what they've been on medication-wise, if anything at all. And then we feel the belly. And the really bad cases, you can actually feel some of the stones in there. On the small doggies, that is. Now, the most common way to diagnose bladder stones is with an x-ray and an ultrasound. It's really good to do both. That way you don't miss anything. You're going to be able to count stones, see how big they are, kind of prep you for the next step. Of course, a urine culture or urinalysis to help confirm or deny a bacterial infection as well is super important because we need to treat that as well as getting rid of the stones. So the next step is surgery. Surgery, you're going to get in there, you're going to get that bladder out, you're going to open it up, and you're going to take out all those stones. You got to clean it and flush it and make sure you did a great job. But once those stones are out, you can start treating it. Your veterinarian may do an antibiotic depending on what they found with the urinalysis and the culture. And just in general, stones are pretty dirty in the bladder. And they may also recommend a handful of different meds for any pain or inflammation post-op surgery-wise. They will do an x-ray after surgery just to make sure they didn't miss anything. And once we have those beautiful little gems, those little stones, we'll send them off to a lab that tell us what they are, what they're made out of. That way we can pick the most appropriate food, supplements, and whatever else we need to help prevent the stones from coming back. Veterinarians tend to do 3, 6, year, month rechecks just to make sure pH, crystals, everything looks good. They may do recheck x-rays and ultrasounds too, really based on whatever stone was removed from the doggy.